Most people over 65 have no idea that some of the biggest threats to their health are not happening in their heart, their lungs, or even their brain. They may be happening quietly inside their digestive system. And here's what nobody tells you. You can eat healthy foods every single day, take your vitamins faithfully, and still become deficient in critical nutrients your body desperately needs. The dangerous part is that many digestive problems don't cause dramatic symptoms at first. Instead, they slowly interfere with your ability to absorb nutrients, weakening your muscles, draining your energy, affecting your memory, and increasing your risk of illness. After age 65, this becomes especially important because your body is already less efficient at absorbing nutrients than it was decades ago. By the end of this video, you'll know the 6 common digestive problems that may be quietly damaging nutrient absorption, what warning signs to watch for, and simple steps that may help protect your health. And stay with me, because the most overlooked problem on this list is something millions of older adults experience every day without realizing the long-term consequences. My name is Dr. Adam, and I specialize in helping adults over 60 protect their health and independence as they age. Over the years, I've seen many people focus on what they're eating, while completely missing whether their body can actually absorb those nutrients. Let's start with number 6, acid reflux. Most people think acid reflux is simply a nuisance, a little heartburn after dinner, a burning sensation in the chest, something that can be controlled with over-the-counter medications. But here's why that matters. Stomach acid plays a critical role in breaking down food and helping your body absorb important nutrients like vitamin B12, iron, calcium, and magnesium. The problem isn't just the reflux itself, it's what often happens next. Many older adults take acid-reducing medications for years. While these medications can be very helpful when medically necessary, long-term use may sometimes reduce the stomach's ability to absorb certain nutrients. I remember a patient named Barbara, age 71, a retired school secretary. She was constantly tired. She thought aging was the reason, but blood testing revealed a significant vitamin B12 deficiency. After reviewing her history, we discovered she had been using acid-suppressing medication for years without monitoring her nutrient levels. Once her deficiencies were addressed, and her treatment plan was adjusted with her physician, her energy improved dramatically. Have you ever noticed unexplained fatigue even when you're getting enough sleep? Sometimes the answer isn't obvious. Now this brings us to number 5, chronic constipation. Most people see constipation as an uncomfortable inconvenience, but this is where things get interesting. When waste sits in the digestive tract for prolonged periods, it can disrupt normal digestive processes and often signals that the gut isn't functioning efficiently. After age 65, slower digestion becomes increasingly common due to reduced physical activity, medications, dehydration, and natural aging changes. The hidden risk is that constipation may discourage people from eating fiber-rich foods, fruits, vegetables, and other nutrient-dense foods that support healthy aging. Over time, nutritional quality can suffer. I had a patient named Frank, 76, a retired mechanic. He avoided vegetables because they seemed to worsen his constipation. As a result, his diet became heavily dependent on processed foods. His energy dropped. His blood sugar became harder to control. He felt sluggish most days. Once we addressed hydration, physical activity, and a gradual increase in fiber, his digestion improved and so did his overall health. Most people miss this connection completely, and the next digestive problem is even more common. Number 4 is low stomach acid. This may sound surprising because everyone talks about too much stomach acid, yet many older adults actually develop too little. Stomach acid naturally tends to decline with age. Here's why that's a problem. Without adequate stomach acid, proteins are harder to digest. Important nutrients become harder to absorb. Harmful bacteria may survive when they should have been eliminated. This can contribute to deficiencies in iron, calcium, zinc, and vitamin B12. The warning signs can be subtle: feeling overly full after meals, bloating, frequent burping, indigestion. Sound familiar? Many people assume these symptoms mean they have excess acid, when the opposite may be true. We'll come back to why that becomes important in a moment, because the next condition often develops alongside it. Number 3 is small intestinal bacterial overgrowth, often called SIBO. That simply means too many bacteria growing in the small intestine where they don't belong in large numbers. When this happens, those bacteria may consume nutrients before your body has a chance to absorb them. Think about that for a moment. You eat the food, but something else gets the nutrients first. The result can be bloating, gas, abdominal discomfort, diarrhea, fatigue, and nutritional deficiencies. One patient I remember was Linda, age 68, a retired nurse. She had persistent bloating after nearly every meal. Multiple diets failed to help. She became frustrated and started avoiding healthy foods because she thought they were the problem. Eventually, further evaluation identified bacterial overgrowth. Once properly treated under medical supervision, many of her symptoms improved and she felt comfortable eating nutritious foods again. What happened next surprised her. Her energy levels improved more than her digestion. That's because nutrient absorption began improving as well. Now let's move to number 2, and this is one of the biggest hidden threats after age 65. Inflammation of the digestive tract. Inflammation simply means irritation and damage inside the digestive system. Sometimes it results from conditions like inflammatory bowel disease, sometimes from infections, sometimes from long-term digestive disorders. Regardless of the cause, chronic inflammation can damage the lining of the intestines. Why does that matter? Because the intestinal lining acts like a gateway. Nutrients must pass through that gateway to enter your bloodstream. When the lining becomes damaged, absorption can suffer. Protein, iron, folate, vitamin D. Many nutrients may be affected. The consequences can be significant: muscle weakness, fatigue, poor immunity, slower recovery from illness. And after age 65, losing muscle and strength can directly affect independence. This is exactly why paying attention to digestive symptoms matters so much. Persistent diarrhea, unexplained weight loss, blood in the stool, ongoing abdominal pain. These symptoms deserve medical evaluation. Never ignore them. Now, before we get to number 1, I'd like you to tell me in the comments, have you experienced any digestive symptom recently that surprised you? Just one symptom. I'm always interested in hearing what viewers are noticing. Now let's talk about the most overlooked digestive problem on this entire list. Number 1 is celiac disease and gluten-related intestinal damage. Many people think celiac disease only affects younger adults. That is simply not true. Some people are diagnosed for the first time in their 60s, 70s, or even later. Celiac disease occurs when gluten triggers an immune reaction that damages the small intestine. The frightening part is that symptoms can be very different from person to person. Some people experience diarrhea, others experience constipation, some develop anemia, others struggle with fatigue, memory problems, or unexplained weight loss. Many don't immediately suspect a digestive issue at all. I remember Robert, age 73, a retired truck driver. For years he battled fatigue and weakness. He thought it was normal aging. His blood work repeatedly showed nutritional deficiencies despite taking supplements. Further testing eventually revealed celiac disease. Once he received the correct diagnosis and treatment plan, his nutrient levels improved significantly. What concerns me is how many people assume declining energy is simply a normal part of getting older. Sometimes it isn't. Sometimes the body is sending a signal that nutrients aren't being absorbed properly. And that's the key message of this entire video. Nutrient deficiencies don't always start with poor food choices. Sometimes they begin with digestive problems that quietly interfere with absorption. The good news is that many of these issues can be identified and managed when recognized early. If you've been experiencing ongoing digestive symptoms, unexplained fatigue, weakness, weight changes, or persistent nutrient deficiencies, don't assume it's just age. Talk with your healthcare provider, ask questions, pay attention to patterns. Your digestive system does far more than process food. It helps determine how much nourishment reaches every organ, muscle, and cell in your body. If this video helped you, subscribe to Dr. Adam. Every week I share practical health information designed specifically for adults who want to stay active, independent, and informed as they age. And in the next video, I'm going to reveal several surprising signs that your body may be lacking essential vitamins even if your diet appears healthy. Some of those signs are hiding in plain sight. Before you go, I want to leave you with a simple challenge. For the next 30 days, keep a small notebook and track any digestive symptoms you notice. Bloating, heartburn, constipation, diarrhea, changes in appetite, anything unusual. Then bring that information to your next medical appointment if symptoms persist. Small clues often reveal big health issues. Remember, the goal is not perfection. The goal is awareness. The goal is protecting your health before small problems become larger ones. Because the more you understand what your body is telling you today, the better chance you have of staying strong, independent, and healthy for years to come.